Now, boosters are being planned as early as the fall for people who already got those 2 shots of Pfizer and Moderna vaccines. But we already know, we're already seeing those immunocompromised individuals getting shots right now. So, Dr. Barakat, are you seeing that in your patients? Are they asking to get that 3rd shot?
Well, I think certainly they're aware of the fact that they've heard that the CDC and the FDA have recommended a 3rd shot for immunocompromised patients. And this really came about when they looked at solid organ transplant patients who are really a very immunosuppressed population. They take immunosuppressive drugs to prevent organ rejection, but so are cancer patients, so are patients with HIV, and other patients who take chronic steroids and other immunosuppressive drugs. Um, what's shown is that the initial antibody response to these vaccines is lower than in the general population. So they really don't uh, uh, form such a strong immune reaction as a normal person would. Therefore, this isn't, in a sense, a booster. It's really just a continuation of the vaccination schedule. So we're now recommending that they get a 3rd vaccine. Um, in terms of our patients wanting it, yes, they're aware of it, they hear it, but we have to be a little bit clear. We are talking about cancer patients who are actively being treated or have recently completed treatment within the last several months as being the highest priority. Sure, the immunosuppressive effects of some cancers can last for a long time. There are different types of cancers. There are solid tumors like lung cancer and breast cancer, and there are hematologic diseases like leukemia, which tend to be more high risk. But I think someone who's had cancer 10 or 20 years ago, while eventually they will probably require a booster,
Mm.
they're not the ones we want to give that 3rd dose to. Those are those patients that are actively on treatment or have recently completed treatment.